Okay, thank you so much. Yeah. Thank you, Dr. Korede. Thank you so much for this invitation. It's a pleasure to be here. And I guess good morning, good afternoon, good evening from wherever you're joining from, because I know it's an African program and some people are actually watching us live on Facebook. So I am Korede Yusuf. I am a physician by training, and I'm a public health educator and scientist. A little bit more about my background. I trained in Nigeria, where I'm from, as a physician at the Adelphi University of Technology, after which I practiced as a GP for about 5 years before moving down to the United States to pursue graduate studies in public health. So I went to the University of North Carolina, Chapel Hill, and I got my MPH in maternal and child health. Then right after my master's degree, I just got very interested in epidemiology, which is like, the backbone of public health research. So I decided to pursue doctoral degree in epidemiology, and I went to University of South Florida in Tampa. And that was where I met Albanese. She's here with me today. It's nice to have her here. Right after my doctorate degree, I got my current job in Adelphi University as an assistant professor, and I've been teaching in the Master of Public Health program for over 6 years, a little bit about 6 years. Let me see. And my research interests, I actually describe it as broadly maternal and child health, reproductive health and health disparities. I'm very interested in research that has to do with Africa and Africans in diaspora, even though I feel like I've not done so much in that field compared to the work I've done on maternal and child health issues in the United States, and I would really love to develop that. Currently, I'm an associate professor. I just got promoted and tenured, so that's exciting, in the same program at Adelphi University. So I teach master's level students, and of course, I do research as part of my role at the university. So that's a brief introduction about who I am and what I do.
Thank you very much for that. That was quite extensive. So based on, what this meeting and seminar is about, that, we're trying to just have conversations around conducting research on the continent. If you want to develop or improve something, you first of all have to maybe understand what you have on ground currently, what challenges, what works, the bright spots, I call them, like, the bright spots, what's working, what's going well, the pain spots, what people are complaining about, and then the growth spots where we can work on and, be able to make leaps and bounds. So before we, delve into specifics of that, I wanted to ask what your inspiration is because again, you've been in the US for several years, and it's easy for you to just work on research where you are. There's a lot to do, but what inspired you to extend your research interest and activities to African countries, and what has the journey been so far?
Well, Africa is home, right? Nigeria is home. So I grew up seeing the reality of the sufferings in Nigeria, in Africa, especially in the healthcare system. Going to medical school in Nigeria, I was actively aware of the healthcare system, the health issues, so many deaths that are preventable, so many deaths and illnesses that are due to preventable causes. So I lived that experience. Then I also practiced for a while. In fact, part of what led me to public health was the fact that I was overwhelmed with the health issues in Nigeria. Like, I would go to work, and on a daily basis, I worked in a general hospital. I would see 80, 100 people. And these were cases that ordinarily were preventable, right? I saw women, children dying from preventable diseases. And I just told myself, I can't continue to do this, right? This is not the way to go. And I thought that, coming to the United States to get a public health degree would make all the difference, right? I thought I had some superpowers. And yeah, that was actually what led me here. So in my doctoral program, I started with the intention of doing research back home actively. Unfortunately, I didn't really have professors who did global health work. Fine, I got the skills that I need to do the global health work, but that mentorship was really lacking. And all I could do at that point in time was to gather colleagues within the same school who were interested in global health work. We would sit down, do data analysis, right, using probably like DHS data sets, mixed data sets from Nigeria, from different countries, and present at conferences. So those dissemination did not go beyond presentation at conferences because we didn't have higher level mentoring, right, or support. So I just knew I had to do something, even though, in my doctoral training, I didn't have that, support to do global health work. So I'm aware of the issues and I can't just, remain blind and say, well, I'm comfortable in the United States. I came here with that intention of contributing to making a change or difference in public health in Nigeria. And that's something that is still there. So I'm still passionate about, contributing my own quota in whatever way I can to improving public health, particularly maternal and child health. And I feel like, I can actually make more impact back there, where the resources are limited, where the needs are enormous.
Yeah, thank you for that. I think in many people that I've spoken to who are, doing a lot of things, either research, either philanthropy, whatever it is being immersed in a problem for so long, or even for just a little bit, gives you a deep understanding of it and just a very deep connection to it. Many of us grew up there and we saw, and it drives you. That's, part of the passion. It drives you, and there's multiple fields, there's multiple ways that we can help, and we're all just trying to contribute our quota to that. So I know you said you didn't you haven't gotten to actually conduct research, but do you know of right now in your role at your current university, do you have students or groups that are doing global health work, and how have they been able to access funding? Because that is one of the big things, funding, and also collaborators with residents on the continent, researchers who are resident in the continent, or in others in diaspora.
Okay, well, so I didn't say I've not done
I'm sorry.
work in Africa. So I said I've done minimal work. So I guess I was trying to tell you about my experience during my PhD training, that I lacked that mentorship to do global health work. But I'm currently doing some global health work. So I said I've done most of my work in the United States, but all the grants that I've applied for, they have to do with research back in Nigeria and, research among immigrants, African immigrants in the United States. Right. So I've done some work back home. So about 3 years ago, I did work related to intimate partner violence in Lagos, Nigeria. So I collected data from survivors, perpetrators, and key stakeholders, right, involved in intimate partner violence practice and research. Recently, I got a grant from Merck Pharmaceuticals to do some work regarding human papillomavirus vaccine uptake in northern Nigeria, right? So of recent, in fact, only last month, the federal government of Nigeria introduced the HPV vaccine. So it's going to be part of the routine immunization program in Nigeria. So I heard the news last year or 2 years ago, and I was like, okay, this is probably the time to apply for a grant to study about HPV, find out if people get the vaccines, what are the intentions, what are the barriers to uptake, in order for us to identify early what interventions might work to increase uptake. So I have that grant. It's still ongoing in northern Nigeria. So back to your question about accessing funding to do work in Africa. I've had experience applying for probably like applying to different funders, about 5 different ones, and there were mainly foundation grants, pharmaceuticals, and internal grants from the university. I know there's so many opportunities out there. We have public funders. I know the US National Institute of Health funds a lot of global health research. We have a lot of foundations. I applied to Bill and Melinda Gates Foundation before. I was not successful. They have a lot of funds too. We have the Robert Wood Johnson Foundation. We have, so many global health funders. That's actually a global health database for funders that you can just Google and, and have access to. But the fact is that there are other funding mechanisms that are not really obvious or out there. So for example, like the grant I have currently from Merck, if I'd done a Google search to see who is going to fund my global health work, Merck wouldn't have showed up in any way. So I was able to get the Merck grant through networking. So in fact, the Bill and Melinda Gates Foundation grant I applied for was through networking. So I, speak to friends. I'm interested in this kind of research, in this kind of work. If you hear of any funding opportunities, please let me know. So a particular friend of mine who worked at Merck at that time just told me, oh, I remember you said you're interested in this kind of work. You may want to look at this particular website. They have some funding. I looked and it was even glaring that they had money for global health work. So they only listed vaccines. And I was like, okay, vaccines, HPV vaccine is going to be a thing in Nigeria soon. I can apply. They didn't say they wanted to fund global health work, but I applied, the knowledge I had. I was able to show them that there was a gap. This was really important. And, I got funded. So it's not sufficient for you to look out for funding through the traditional mechanisms, like looking through the database. Networking is really huge. Speak to friends, speak to colleagues, let them know about your interests. So if they know of anything, they'll let you know. But yeah, the database is there for global health work. The non-traditional funding mechanism, like I said, pharmaceutical companies, they have a lot of money for studies related to vaccines in particular. And of course, the public funders, right? The US NIH, the Canadian National Institute of Health Research, the UK Medical Research Council. There's so many opportunities out there. Then there's a question you asked me that I've not answered. Can you remind me?
I talked about connecting with collaborators, either here or in Africa.
Yeah, that's an interesting one. Dr. Kufoido, I don't know if there's a database of researchers who do work in Africa. Right, that's something I would love to work on. Right, let's have a database so people can go in and search. I want to do work in Kano, Nigeria. I want to do work in Republic of Benin. Something on reproductive health. Who are the investigators who do this work? What's their number? What's their email? Are they available for collaboration? So that's the kind of database that we need. But I'm going to tell you about my own experience with identifying collaborators. So for the current grant on HPV vaccination, what I did was to reach out to my colleagues from med school who I know are in the public health field. I just texted them, emailed some of them to say, well, I want to apply for a grant and I'm hoping to do work in Kano, Nigeria. Do you know of public health researchers who have this kind of skills that will be willing to collaborate with me? That was what I did. And, they emailed me back and forth. I got responses. I reached out to all of them, called them, texted them. Then after, discussing back and forth, I penned down one person. I identified one person and I thought it was the best fit for me, right? So it's more of, speaking out to people. So we need in public health research, in sciences generally, networking is important. Collaboration is important. And that was the way I did mine. I reached out to people and they linked me up with people in the field who had similar interest.
Yeah, thank you for that. I guess that's why it's there, in public health and in a lot of spheres that your network is your net worth. So yep. It's always helpful to have people. Mm-hmm. In the work that you've done so far, because you've mentioned different regions and different states in Nigeria that you worked in, what are the challenges? Because I know different states and different cities have their, different cultures, socioeconomics, penetration, infrastructural. So what were the challenges? How did they mirror and how did they differ to one another?
Well, before I talk about the challenges, there's probably one strength that I need to talk about. And that is the fact that Africans want to be involved in research, right? They want to be involved. They want you to interview them. They're willing, even with regards to sensitive topics like intimate partner violence, the perpetrators were willing to talk. The survivors were willing to talk, right? So they're not over-researched like Americans or people in developed nations. When you do studies in developed nations, the response rates are very, very low. I can tell you that for the ongoing study we have in Kano, we interviewed over 1,000 caregivers, right, who have children between the ages of 9 to 14. Nobody declined completing the survey. Nobody, like everybody we spoke to. So this was like a multi-stage random sampling that we did nationwide. They all, took the survey. So that's a big strength, right? We have the people who are interested. It's easy to gather the data if you have the resources. Now to the challenges. You need to understand the country. You need to understand the state. You need to understand the people, the culture, where you're going to, right? So for example, if you're going to Northern Nigeria, right? So what's their culture? Maybe there's a way they expect you to dress. There's a way they expect you to speak. So if you want them to accept you, then you have to appear that way, right? If you want them to listen to you, you have to appear that way. One big challenge with doing research, I would say for me in Africa, is probably the attitude of the people to work. I don't know if it's an African thing or a Nigerian thing, or maybe because I have been here for a while, the work ethic is actually very different in developed nations compared to developing nations. So that was a big challenge for me. So it wasn't like I micromanaged, the people that had to do the work, but I really had to be there. I really had to be asking questions, like train and retrain and monitor, be sure that they're doing things correctly, because you can't just afford to leave people and hope that, they'll do the right thing. I'll give you an example. So when I went to Kano, I had to train the data collectors, and these were very good people, highly motivated. They were passionate about the topic. They've been involved in data collection regarding reproductive health issues in Nigeria for a very long time. We had some new, unexperienced people. So that wasn't the problem. So it wasn't a problem of their passion for the job, right? So I trained them, emphasized what was important, the practice. The first day after they went into the field, reviewed the data they collected, gave them advices. You have to do things differently. You have to pay more attention to this. And guess what? I only left for like one day. I did not monitor again because they had somebody who was, coordinating. I had a collaborator, a partner who was meant to be in charge. By the time I went back, I was like, I'm in trouble, right? So I had a lot of missing data. And I was like, what's going on here? You guys didn't ask all of these questions. Did you skip them? What really happened? So we had to go back to the field, resampled some population to collect the data. Right? When I told them they were going to go back, they didn't believe me. I'm like, but, we have good data. I was like, yeah, but you're going back. This is not good enough. Yes, I know. You're recollecting the data. They thought I was joking, right? So that's the work attitude. And I made sure they went back into the field to collect the data, to do the data collection again. So the people's attitude to work, you really have to be on top of your game, monitor closely, make sure you're retraining, you're monitoring what they're doing, looking out for quality issues. So for me, that was a big challenge. Another challenge with doing research in Africa is the issue of transparency regarding funds, money, right? We know in the United States, investigators don't handle money directly, right? So if you get funds to do research, it goes to your institution or to your organization, and they pay for those things. But in Africa, a lot of times, the investigators, right, the partners, they get the money, they're the ones who manage the money. So that can be a problem, right? But it depends on you as the collaborator here or as the PI if you really, want to monitor that thoroughly, if you care, if you do not care, if all what you care about is for the work to get done, because it's very complicated, for you to say, well, you want to do the science, right? And at the same time, monitor funds, right? But that's a big issue, transparency with regards to funds, transparency with regards to data collection. I've heard of instances where, data collectors actually made up data. So you really need to be, on top of your game and monitor closely, find ways to look at your data set to monitor if, things do not add up, if people made up the data. The other challenge is probably the political landscape, right? When you talk about things like security. Okay, so in Kano, for example, I would have loved to participate actively in data collection, go into the field, but I could not do that, right? For security reasons, I could not do that. So I had to let the people who are from the region, who speak the language, go in there to the data collection. So, security is another big issue. I think there's, so many other little things. But again, as an investigator, it's very important that if you have a collaborator there, let it be somebody who is local, who understands the people, who understands the culture, who can guide you all right. So for example, I remember when we were designing our focus group discussions, I didn't think it would be a problem having fathers and mothers in the same group discussing issues on vaccination. And, I was called to my attention was called to the fact that, well, you can't do that. The women won't speak, right, if the men are there, and the men too won't be comfortable. So we had to, organize separate focus group for fathers, separate focus group for mothers. And regarding key informant interviews, we really had to think about it properly. So if you're going to speak to an imam, we should conduct an interview. So we identified, male interviewers to do those interviews. So, there's those little things that you just need to focus on. And for you to get work done in Africa, you actually need to be humble. You need to come down to the level of the people. Do not speak like you're in charge, you're from America, you know it all, because there's just a lot to learn from them. They know the environment better than you. Yeah, they know the issues better than you. You know probably the signs. So there's just a lot. So when you're humble, you try as much as possible to appear like them. Like I remember dressing in my Ankara a lot of times and, I'll throw my hijab around my neck and they just, felt comfortable around me. So there's just a lot to consider and very important, to understand people, to understand their culture and, their way of life.
Thank you for that. That's really, how would I expound on one of the reasons why we're doing this, because trying to really highlight Africans in diaspora who do have a good measure of cultural sensitivity and cultural competence. And again, just like you mentioned, you're from the southwest part of the country. So going to work in the north is you still need to learn, and we need to understand the culture and demonstrate cultural sensitivity and equip ourselves. And those are the things that you've mentioned in terms of dressing like them as much as possible to appear, as it's kind of like a camaraderie. People feel like, oh, she's one of us. We can
it's
really
not different here.
Yes. And also, in terms of being able to learn from them, I think these are one of the pillars of participatory research. I strongly believe in participatory research, that you have to collaborate, especially working in areas where you're not familiar, you're not a local, you don't know the culture. Many countries, not many communities, really push against this helicopter research. And like you said, you come in, you're just this distant, unreachable, unattainable, unknowable entity, they can't relate to you, and you just come, you get their information. A lot of it is they're vulnerable with you, and then you just go, right?
Yep.
And they just feel used. But many times, if you learn from them, you sit with them, you eat with them, there's less, that feeling of vulnerability is less. It's like, my sister is here to do something to help us, and I'm just sharing information, not an outsider is coming. So I'm very glad that you highlighted that and you mentioned that. Now going to, you had, my next question was, what are the strengths? What did you glean? And you already mentioned that first. What would you say are opportunities for upcoming researchers, young ones, who, even people who are, already at our career level, who either want to change or want to just develop interest or do something? What would you say are the opportunities that are available to explore?
Well, so one thing that I've been thinking about is regional collaboration, right? I think a lot of researchers have not explored that. A lot of times, Africans are looking to collaborate with people in the developed nations, right? People in the United States, in the UK. But we can actually gain a lot from working within the region because our problems are very similar. The people are very similar, and there's power in number, right? So if, two countries or researchers from 3 different West African countries come together to do work, then it's more solid. They bring in different perspectives, there is diversity of idea and all of that. So I think that, upcoming researchers, including myself, we need to, find time to identify researchers within Africa who are interested in similar work, come together, collaborate on grant writing, collaborate on research, collaborate on writing for publication and disseminating research findings. There are a lot of opportunities too for trainings abroad, right? For fellowships and trainings abroad. The developed nations, they've realized the importance of investing in global health. They've realized the importance of training researchers in Africa. So those opportunities are there. I'm not saying that researchers in Africa are not smart, they're not great, they are, right? But we can't know it all, right? So there's opportunity to leave your region, to leave your continent, to learn about new methods, to learn about how things are done differently in other places, to learn about research ethics, which is very important, right? Leaving Africa, you learn about people's work attitude, you become better too, you become a better person. So I feel those areas, seeking training and opportunities abroad, not with the intention of jackpotting. For those who are from Nigeria, Africa, you probably know that term jackpot, right? Which means just to flee, to escape, right? To emigrate to greener pasture. So not really with the intention to jackpot, to leave, the country, but, to get the knowledge and the skills necessary, to improve the African continent. So collaboration within African continent and, seeking those research trainings abroad. And seeking funds too, right? That's a big thing. And for upcoming researchers, one big thing is mentorship. Like I tell anybody who is thinking of pursuing doctoral training, like I feel the most important thing in a doctoral program is mentorship. If you don't have that, then don't start, right? Find a place where you get that mentorship. So even after doctoral training, as an upcoming researcher, you need that mentor. You need that mentor that would guide you through the whole application process, applying for grants, that would share with you opportunities for trainings, right? That will lead you in writing, big grants. Yeah, I guess those are my ideas regarding opportunities for upcoming researchers.
Sorry about that. Thank you very much for that. I know that, like you said, getting knowledge and a lot of that, it's not like anybody is not intelligent, but it's not so much about intelligence, it's about having the knowledge. And no man is an island, even the people who, even in the Western world or the developed or the global north, they're still learning. And that's what research is about. So, and they're still figuring out new ways to do things and to do things better. So everybody has to learn. And the reason why we're highlighting African researchers in diaspora is that we bring something also, something different to the table, to the market, to that research group. And sometimes it's just having access to a different way of doing things or more newer methods that have been tested, whereas our counterparts, have not worked in that way or tried those methods. And we can be like, okay, you haven't done this, I've done it. This is what you're doing. And let's see how we can merge and, be able to put things, because at the end of the day, we want such that we want to be at par, in as much as possible, we want to be at par. So it's a knowledge exchange or knowledge transfer of the sorts. The other question I have is, what would you say are the gaps in the research that's done on the continent of Africa and African countries and other parts of the world, especially the global north? I know that places like India, parts of India count as the global south, but we also know that in terms of penetration of research, they probably have more penetration than Africa as a continent or African countries. So what would you say are the gaps and, the differences?
Well, for me, I think it's about the quantity and the quality of research that we do, right? The quantity and the quality. And these are related to so many factors. I know over time, Africans have been doing more research, they've been publishing more, especially in probably like 5 or 6 countries. I know Nigeria is one of them, South Africa, but we're still not doing well enough. I remember reading an article from the University of Cambridge recently where they said 1% of the publications, like science publications, actually come from the African continent, in contrast to Africa making up about 12% of the world population. So that means we're not doing enough, right? So it seems like we're publishing, but we're not doing enough. And most of the publications actually come from the outfield, right? Probably half of them. The other issue is with the quality of the work. I review for journals, I review some articles that come from Africa, and I'm like, we can do better. Some from African countries where maybe people are not native English speakers, we're not native English speakers, right? Or maybe the methodology is not good enough, or the sample size is really small because they don't have the funds, right? So they know what to do. They know the right methodology, they know how to do things rigorously, but they don't have the money to do it the right way. So you have a study with a sample size of 100, right? You have a study that, ideally they should, use random sampling to get participants, but because they don't have the resources, they don't have the money, they don't have the, the staff to do the data collection, they use convenient sampling. So these are, for me, the main issues is about the quality and the quantity of research. And when we talk about these two things, they're linked to several factors within the continent. Funding to do global health work, right, is limited. The skills required, the knowledge required, so we need more opportunities for people to, to get fellowship and trainings in developed countries and world standard institutions, right? The government, we don't really have an enabling environment. So if the environment is not enabling for research, people do not have money, they can't even focus, then what do you expect about the quality of work that would come from such an environment? So there's so many factors, that leads to, the poor quality, right, of our work, and the poor quality and the minimal quantity of research that we do in Africa.
Thank you for that. And, the points you mentioned are very, very valid. It's interesting because one of the things that people mention, or researchers in Africa, especially Nigeria, where I'm from, mention is, the cost. Even for those of us who are abroad, you can't publish in some places just because it costs so much. And the places where it doesn't cost as much, maybe the screening is more rigorous, or the quality or the level of research, they're telling you they want innovative thing, something that's cutting edge, and it puts a lot of challenge. So imagine when researchers who are here have that challenge, think about how people who are outside with limited resources, limited things, do that. So I think that's definitely one of the things. And who knows, maybe we can see, we have, change of government, they're trying to inject new blood. We can see, hopefully, or push for, in a way, that they do something to support the research community. The last question on my part are, what are the 3 things or 3 areas, and it could be less, that you think are crucial to be worked on or to be touched upon to improve our research capacity and output from African countries?
Yeah. Well, I think I've talked about funding a lot. So funding is important. Funding for research, right? Grants for research, funding for trainings and fellowships abroad. Those are very, very important. The government needs to be involved, right? It shouldn't just be us expecting funding from donors abroad. We have big private sectors within African continent that can support our research. The other big issue is the issue of brain drain, right? So when the brightest minds, when they leave the African continent, right? A lot of people live with the intention of doing things to improve Africa. But it's so difficult for you to focus on Africa if you're here in the United States, right? Like I said, I do global health research, but most of my work, right, has to do with the United States, even though I'm trying hard to do some work in Africa or in Nigeria, right? So brain drain is a big problem. And we just, I don't know how we need to, mitigate that or curb it, create an enabling environment, so that, these bright minds can stay back home. And in the event of, us not being able to achieve that totally now, another way would be for us to work with Africans in diaspora to support research back home, to do research to improve public health back home, right? In whatever ways. It's not just by sending money home. Use your skills, use your knowledge to improve health outcomes in Africa as a whole. I guess the third thing, the third thing will be, the willpower from the government, the policymakers, right? If the government really creates an environment that is enabling, security-wise, economic-wise, they show an interest in public health, right? They use public health research findings, they translate them into policies. Then researchers too will be more motivated to do a good job, right? And share the findings with the hope that, these results would translate into policies or translate into practice or, research programs or interventions. So for me, those are, 3 areas that we need to work on, making more funds available. The funds would also help in increasing the quality of the researchers via fellowships and trainings. Do our best to keep people back home as much as possible. And for those who we cannot keep, find a way to involve them, to collaborate with researchers back home, or to go back home and do work that would, innovative work that would improve people's health. And the government. Yeah, I don't know. I don't really know, what we can do about that, but we really need the government support to create that an enabling environment for researchers to thrive and be able to do their great work.
Yeah. Thank you very much.
I think there's a comment in the chat box.
Yes. Mr. Abdulwahab,
Yes.
says philanthropy
Philanthropists.
also
Yeah.
play a role
Yeah.
in supporting research. Yes, and I agree. I know that there are organizations like the Dangote Foundation, but they fund more of projects, not research programs that are already implementing stuff. I think the T.Y. Danjuma Foundation does similar. However, the Aspire Coronation Trust, which I think is funded or supported by Access Bank, does research in a way, I guess, but I think it's also more programmatic.
Yeah.
But like he said, yes, these are entities that have access to funds. I mean, they could be equivalent of the BMGFs, the CHIs, and they could also pivot into, and in one way, again, coming to that is, how do we make them and the government see that it's not just programs, but you have to collect the data. Data has to drive what you're starting, how you're redoing, redesigning, and also pushing forward. And the last thing you mentioned, which is the government, it feels very daunting because it's almost as if we know, but we don't know. Nigeria is so, I mean, it's interesting because a lot of these things, when we understand the way things work, you would know that a lot of things really cannot move without government backing and support. Yeah. And the primary role of the government in things like this is to create an enabling environment. Sometimes it's not necessarily to create all of the money, but it's to create they could set up a fund and call for people like the Dangotes, the whoever it is, to put into it. They have a lot of taxes and tariffs that they could pull 1% of something from. For instance, the new government passed something about like an education sponsorship bill where the government will provide loans for people for higher education, and it was going to be pulled from some government tariff, and they could do the same, just like how I think there's a petroleum trust fund or education trust fund that comes from petroleum, something about petroleum. There's like a 1%. And this can also be done with research, and maybe an institution like NIMR, which I would say I think is equivalent to NIH here, can anchor that. So the money is essentially still coming from people. It's just going through the government coffers and things. There's so many things that can be done. There's so many innovative ways, but at the end of the day, you need somebody and you need an entity in the government to take interest, buy into it, and really push it. Because again, I'm sure it's not just one layer or one person that's just going to get approval. And then you could get approval, the government sets it up, but the implementation gets wonky. So it feels daunting because we all know that, I mean, getting anything done in Nigeria or African countries can be challenging. But I guess we'll just keep adding our voices and hopefully that it adds up.
And hope for a change. Yeah. I like what you said about philanthropists, right? A lot of philanthropists want to support programs, right? They want people to hear that they provided 1,000 bed nets. They provided medications to 1 million people. But those things are good, right? But they won't bring about the change that we want. Like a lot of these developed nations, they grew from innovations. So we need to fund research. We need to fund research for us to see those innovations and development that we expect in the nation, and not just, funding programs that distribute things to the population.
Yeah. Thank you very much for that. We have a few people in the audience. I will give maybe about 5 to 7 minutes. If anybody has any questions, you can raise your hand and we would, Dr. Yusuf can address that quickly. Any takers? Let me see. Okay.
Any questions or comments?
Comments also, yes.
Yeah.
Or you can type them in the chat box if you have one. All right, none yet. So hopefully, probably we touched on a lot of things that people are curious about. But if you have any questions afterwards.
Dr. Madu, I'm not putting you on the spot. Are you there?
Yes, actually I was typing, but it's okay. Since you got me on the spot, let me say it. So I just want to acknowledge Dr. Korede Yusuf for this wonderful, wonderful presentation and awareness. I work with Dr. Yusuf at the same university, the same institution, and I have to say, we are Nigerians, we're Africans. She's way much younger than me, but she's like a big sister in the research world. And so I really appreciate her for being a mentor to me. I have actually done some research with her and learned a few things, especially in data analysis. I'm published with her too. So thank you, Dr. Yusuf. You make us proud in New York, you make us proud at Adelphi University. With respect to what you discussed today, I have to thank you so much. You brought about a lot of things that has been bothering my mind about research in the African continent. Of course, Dr. Yusuf was in my dissertation. She was my dissertation reader, committee member. And so she gave me a lot of feedbacks. And through her support, I was able to replicate my dissertation in Nigeria. So thank you, Dr. Yusuf. So going forward to continue this research that I am interested in doing in Nigeria, you addressed a lot of questions I had as far as where do we get the funding, these collaboration issues and all these things. So one question I will have though, for Amal Outreach, Dr. Yusuf, anybody, is, the political climate which Dr. Yusuf mentioned before. How do you think we can get the politicians and the universities, academicians, to merge together so that this work can really be done? Because I could bring on my passion, I could bring on my mentors like Dr. Yusuf, but when we actually come to do it in person, we can meet some bridges along the way. Let me give you an example. I'm a nurse practitioner, and I have interest in health care in the rural communities like Dr. Yusuf is doing. But I found out that when you go to the primary care health centers in the village, the political climate and the way things go, it's not easy to fit in and make sure you do what needs to be done that we have learned outside. So when it comes to funding, who helps to do this? Not to take your time, how can we get the politicians and the researchers and the health workers to come together so that this work can be done without thinking about issues with this funding? At the end of the day, we want the people to do better. We have so much money in Nigeria, and yet people are suffering in the villages. And we know what to do, but we can't get in. So help us. How do you think we can do that? Maybe Amal Outreach will write a letter to the politician, who knows? Take it from there, please. Thank you, Dr. Yusuf. I really enjoy listening to you.
Wow, thank you so much, Dr. Madu. Thank you for your extremely kind words. You're too sweet. Thank you so much. I don't even know what to say about everything you said, but I appreciate it. To your question, that's a very difficult and complex one, right? How do we get the politicians involved? And of course, we know to make changes, right? They are more effective if they're at the macro level, not micro. So if you're tackling things from the level of the government, then we can make, a huge or larger impact. That's a tricky one, but I'm going to talk about Nigeria now, not Africa as a whole. Leadership is key when we talk about the African continent. We're still lacking in leadership. We don't have the right leaders in position, but I kind of feel like there's hope. So recently, I know Nigeria appointed new ministers, and I looked at the Ministry of Health, and I think we have good ministers. The person who was made Minister of Health is top global health researcher who worked with the World Bank, the World Health Organization. The Minister of State, who is a deputy, he's been in diaspora for years, so he's a renowned nephrologist from here, and they are both open to work to make a change in healthcare in Nigeria. One of the key things they also said they want to focus on is this brain drain regarding doctors and researchers. So it's tricky, but hopefully with those kind of people in position who understand our plight, we can reach out to them, right? Solicit for their support, for their help. And if they don't go with the flow of things in Nigeria, maybe they'll be able to make a difference, make an impact. But it's just, I think it's complicated, right? The whole leadership system is, I don't know if I say it's a mess. I don't know if I'm at outreach because you are out there in the field. If you have ideas on, how we can make a difference regarding getting the political support, right? Or the political will from our policymakers and the politicians. I don't know.
Thank you for that comment and question, Dr. Madu. And when I said that it was daunting, really that's it, because it feels like a heavy cloud. And it's that we as Africans and we as Nigerians in particular, we know we have potential. It's almost like a woman who is pregnant and they're telling you you cannot deliver. Literally, that's, you're carrying a weight with you. We know we have potential. We know we have a lot of power, but everything is just not enabling. There's a lot of things working against us. And like Dr. Yusuf said, leadership is very key. The government's job is to create an enabling environment. And in terms of how, the how is not clear. I think the first step is for us to even be resolved and determine that we want to do this thing. And then the how will come once you have clarity on what you want to do. Somehow the how would figure out. I would say the first step will probably be even just scanning through your social network, like your contact. For instance, we are working in Lagos Island. So we definitely have a state House of Assembly representative. We have federal representatives in legislators, in the legislative arm. And these are people that we could write to, maybe to speak with their colleagues who are in like the maybe health committees in legislation, or something that it could bring up to the minister, say, hey, someone in my constituency wrote a letter about this thing. What can your office do? Maybe that's what we need to do. And sometimes you think it's one drop, but sometimes it just takes one in a stack to make a difference. So they may have been receiving notices and maybe someone just gets a new answer and be like, oh, sir, you've been getting letters about this thing. You know what? This last one triggered something. But I think we all just have to keep trying. Whatever it is, we have expertise, strengths, and capacities in different ways, and just do what it is that you're good at, advocate in whatever way that you're good, and add a little bit more, and we will hopefully get to the precipice where we can break through and transcend to a next level. And, maybe we would discuss in our management and board and see, is there another step in terms of advocating? Because again, we're not just doing this, having conversations to have conversations. We're having conversations to collect, to hear the voices, to collect information. Also, like you mentioned, how do we start having a database of people who are interested in research in African countries, and also people who are in African countries who are doing research, and to be able to form a community that they can tap into and log in and, be able to say, hey, I need someone who's doing this, I need someone who's doing that. So a lot of that, we hope that things will move forward. And yes, they do have new ministers, so maybe we'll see. But thank you very, very much for your time. Mr. Wahab Shitu had a question, but I haven't seen it. I don't know if he wants to unmute.
Okay. So I actually say his comment here.
Okay.
Yeah. Okay. So let's connect. Med school. Okay, so Dr. Shitu. So he said, this will be funny. I want to ask Dr. Yusuf to be my mentor in research work. By the way, she was my senior in med school. Oh, okay. I don't remember you, but let's connect, right? So send me a message via, I don't know, LinkedIn. I can actually give you my email address too. So we'll talk. Yeah.
Ms. McFarland has something to say. You can unmute.
Yes. Oh, good morning or good afternoon, everyone. I don't even know what time it is. I just bumped onto this. I didn't even know there was this presentation. I just opened my computer and I said, oh boy, I can't miss this. But I missed a lot of what, because it started some time ago. Yes, I'm Dr. McFarland, and Dr. Yusuf is my colleague. And I missed a lot because I am also a women's health professional from Boston College. And my focus really focuses more, I mean, my research focuses on cervical cancer screening among women in Botswana. And my last research is I looked at cervical cancer screening in sub-Saharan African countries, and most of them were included. And to look at the barriers, because the research says that we don't screen. And why don't we screen? Because we don't have the knowledge, we don't have the resources. That's most of the things that came up. And our culture also, that's what they're saying. And then what I found was that generally, the barriers were that we don't know much. And so that was the thing that came up. So unfortunately, I missed what the topic was all about, and I could have maybe participated. Right now, I'm also doing the same thing, and I developed an instrument to measure these barriers. And my study right now is encompassing African women in the US, because that's what I was advised to do. They said, don't just focus in Africa, let's know the women in Africa who are here also as well. It's all about cervical cancer screening. So so this is where I am right now. I'm very sorry to come late. I could have come to understand the and it's like I'm saying, like you're saying, it affects all Africans. We all have the same barriers, because it's like the leadership, like you're saying. I don't know much about what started, but this what we have to focus on to give us the resources. Thank you.
Thank you very much, Ms. McFarland.
Thank you, Dr. McFarland, for joining and for participating. Thank you so much. Yeah, Dr. McFarland is an associate professor in the nursing program at Adelphi, and she's from Botswana, so she does a lot of research back in Africa too. Thank you so much. I see a comment here from Dr. Madudo. So thank you, Amal Outrage. Hopefully the new Minister of Health will be a great resource person in this discussion. I agree. I think we can reach out to, the Minister of Health, probably the deputy. And yeah, I think the deputy will be very interested in a discussion like this. We'll make it a big scale thing.
Okay.
Yeah.
Yeah. And I mean, he's a clinician, so.
Yes.
So. All right, don't mind me. I like making faces. But thank you very much to everyone. We're 3 minutes past the hour, and I don't want to keep everyone waiting. We're different time zones. Some people are in the middle of the day in the US, and some are towards the end of the day. But I want to thank everyone for attending, for registering, committing your time, and just listening in and participating in this conversation. We hope to grow our voices and, collect your comments and see how we can move forward. I also especially want to thank Dr. Yusuf, who, has brought her expertise and her knowledge and shared with us. We at Amal Outreach, thank you very much. And we hope to be able to work with you because, again, we're a community-focused nonprofit. We're big on research. We're big on population data because I know that data has to be the bedrock, and data is what drives quality progress. So we hope to be able to work with you. We can reach out to your colleagues also, whatever it is we can collaborate on. We're on ground in Lagos. If you have research you want to implement, you need data collection, we can support you in that. Those are one of the services that we provide, sustainability, collect data. But as an organization, we can either be implementers, sub-implementers, and things like that for your collaborators, for your research projects. So thank you very much to everyone again. I'm Falake Lawal, and we hope to see you at our next installation of our research, African in Diaspora research series. Thank you very much. Have a great day.
Thank you so much, Dr. Lau. Thank you so much for having me. And thank you everyone for joining. This was great.
Thank you.
Yeah. Take care, everyone. Bye.
Thank you.
Bye.
Mhm.